Now to COVID, the Delta variant becoming much more serious as the CDC says the war against the virus is changing. Now says that Delta variant is a mutation that spreads faster than the original COVID strain. The agency's data showing the original strain spread at a similar rate as the common cold, with one sick person infecting two others. Well, scientists say the Delta can spread as fast as chickenpox, with one sick person potentially infecting 8 other people. Now, this is Colorado's current transmission rate map. The counties in red have the highest levels of transmission, making it easier for that Delta variant to spread. CBS 4's Michael Abeyta live right now at the University of Colorado Hospital. And Michael, the CDC says masks will be important once again, and getting vaccinated is still the best protection.
Yeah, and you know, Jim, some people, because of that, might ask, why get vaccinated at all if you can still get sick and you have to wear a mask? But it is important to remember that, number one, vaccination is important. It's only a tool in your toolbox, but it's probably the most important tool to keeping yourself healthy.
It seems like every day there's a new guidance about how to keep yourself safe from COVID-19. The latest, the CDC saying the Delta variant is more contagious than the original COVID-19 strain.
But that viral load doesn't just mean that I'm going to spread it to more people. It also means that when I inhale somebody else's breath, I am getting a massive amount of virus.
If you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
It can be hard to keep straight and, frankly, frustrating. So why is the messaging changing?
This virus is changing.
Think of it as a survival mechanism for the virus. It mutates or changes itself in order to ensure its survival when threatened by things like vaccines or natural immunity.
As variants change, the characteristics and the efficacy of the vaccine changes as well.
But that doesn't make vaccines worthless. They still offer protection from the virus. Vaccinated people might get sick,
but they get very mild symptoms, and rarely, if ever, are they admitted to the hospital.
The bottom line, all viruses mutate. And although imperfect, vaccinations against these diseases work. History shows us that.
Smallpox and polio were eradicated because of vaccinations, not because of herd immunity, not because of natural immunity.
Medical experts say if we want to beat this pandemic, we all have to get vaccinated as soon as possible and follow health and safety guidelines like wearing masks. Either that or
we are in COVID forever.
Now, this states and this nation's doctors and nurses are working tirelessly to fight this pandemic. And you know what? If you don't get vaccinated for any other reason, maybe you get vaccinated just to give them a break. In Aurora, Michael Abeyta, covering Colorado First.